Well, I looked on the internet for some of the best physicians and the most knowledge about plastic surgery, and MUSC came up, and I was like, that's where I want to go. So I talked to my doctors down in Sumter, and I told them I wanted absolutely the best. I wanted someone that had experience in plastic surgery and rebuilding the breast tissue, and so that's how I came here. From everyone's attitude to just the caring spirit, and that's what captured me the most. It's like I wanted to stay with USC because from day one, from the registrar all the way through the procedures, I've really enjoyed the attitudes and the personalization that they give to the patients. And that's what I felt, that they really care about what I'm going through and how to get me through the process here. If I lived in a different state, I would highly recommend, and it will always be my recommendation as long as I'm walking this planet, for people to come to MUSC, simply because from the beginning to the end, you understand the process. People are not talking deep medical terms. They're not talking above your head where you can't understand. And then the spirit of caring is just there. I mean, from the navigator to the registration to the physicians, they follow up, the nursing staff that calls after your procedure to follow up just to make sure you're okay. You feel like you've stepped into an environment where people care. And then coming here, dealing with the flap reconstruction that I had, even when I went through intensive care and I was there, the nursing staff there was awesome. They came in and they were just like, do you hear that? Do you hear the heartbeat? So really, I've gained knowledge that I feel like I can share in all the support groups that I'm a part of. So I would highly recommend people travel to come here. It is well worth it. It is well worth it. I felt comfortable with the drive. I felt like all the physicians have worked with me, worked with my schedule to just make sure it mirrored up and we could do what we need to do to move on to the next phase of the process. Liz was my navigator. I think she is absolutely phenomenal. She led me through everything, every step of the way. And what she always did, I don't care when it was, she was back with me within 24 hours. So that made me feel like, okay, you have thousands of patients, but I feel number one. And if they do that for each patient, that's what we live for. To know that we're not just a number, that people actually care. And so my navigator through this process, she was awesome. Through each surgery I went through, including the tattooing, I'm like, show and tell. Let's talk about it, let's get it out there so that people are more educated about, if you have this type, this is what you can do. Here's some of the physicians you can go to, and things like that. So the number one thing I would like to tell other women is communicate your experience from emotions all the way through the process. Communicate that to your friends and family so that you can help them, because you never know when it could happen to you. And for me in particular, breast cancer was not a part of my family history, and so it was a shock to all of us, but I think it has educated my entire family. So I would say education and communication are the key.